I've watched the Lyme epidemic grow from basically a medical curiosity that affected a small part of Connecticut to what amounts to a regional epidemic that affects all of the Northeast and a great deal of the upper Midwest, including Wisconsin and parts of Illinois, Indiana, and Michigan.
What do you think should be done about it?
I think we need to bring the deer population back into balance to a level that basically interrupts the transmission of Lyme disease, babesiosis, and several other tick-borne illnesses. Not to mention reducing the incidence of deer vehicle collisions, which we also see our fair number of. The reason I think this is because of what I see in the emergency department with deer vehicle collisions and cases of Lyme disease, babesiosis, and other tick-borne illnesses.
Awesome. Okay, anything else?
Not that I can think of.
Okay, it's pretty scary when you see these kids. It's mostly kids that come in?
It's all levels of people. And anywhere you go in an endemic area, if you ask people, you'll hear a story about how they had Lyme disease, their children had Lyme disease, a relative, a friend. I spoke to a person out on Martha's Vineyard once who had contracted Lyme disease, went to the local hospital, the diagnosis was missed. He retired and went to Florida, where he became demented, was put in a nursing home where he stayed for 2 years until a physician down in Florida said, well, maybe you have Lyme disease, tested him, treated him, and all of a sudden he was no longer demented and was discharged from the nursing home. And he said to this day, there's 2 years of his life that he doesn't remember. And you hear all kinds of cases. My cousin's son had this chronic wasting muscle disorder that no one could diagnose until they figured out that he had Lyme disease, treated him, and he got better. And this is the real danger of this disease, is that it often gets missed in its early curable stages, and people go on to develop secondary and tertiary neurologic and cardiac problems, which